Please welcome our two guests, Morgan Reinhardt and Janae Schumacher. Morgan is a registered dietitian and the supervisor of inpatient clinical nutrition at Bozeman Health, and Janae is the nutrition services assistant manager with a certification in dietary management and food protection, also at Bozeman Health. Could you please give us a explanation of what dietetics and nutrition is?
I can. I think to put it really simply and just kind of distill it down, dietetics and nutrition is the practice of evidence-based science and medicine applications, guidelines, those types of things when it comes to all things kind of nutrition related. So there are several different areas that folks can get into within dietetics and nutrition. There's community nutrition. So, for example, like working at a food bank.
Mhm.
There's public policy. So, people who work with the government and lobby for things that are in people's or folks in the nutrition industry's best interest. There's sports nutrition, which a lot of people are interested in. We get a lot of interns that are really into sports nutrition. There's food service, and Janae does a lot of that. Um, and then there's clinical nutrition, which is what I do. So I do inpatient clinical nutrition, and then there's also dietitians who practice outpatient clinical nutrition.
Awesome. So I'm just gonna go a little bit into your guys' personal backgrounds here so we can kind of build into like how you get into the career. First, I'm gonna go to Morgan. Looking back at the beginning of college, did you plan on going into dietetics? Or like what was the pathway there?
I did not. I grew up in Belgrade in the 90s. And so, growing up in a rural area, I'm the first person in my family to graduate from college. So I didn't have a lot of advice from my parents. And I didn't really know what I wanted to do. So I went to MSU after I graduated from high school, and my major was graphic design and art history. So I kind of did a 180. Um, I decided that wasn't for me. I actually took a break from college for a few years and I worked, I moved around. And when I came back and started going to MSU again for the second time, I was in animal science and pre-veterinary medicine. Thought I wanted to be a vet. So um, I had taken a lot of math, science, physics, all of those things. And I had also worked at a vet and was sort of discovering that that was not my thing. I love my pets, but maybe not other people's. And so I had a friend who was taking Nutrition 101, and she told me how interesting it was. And so I decided to take it. And I liked it enough that I changed my major to food nutrition science my junior year in college, which made it a little tough to still graduate on time. I had to kind of pivot and take all these different classes that I wasn't planning on. But that's that's how I ended here.
Hmm. Awesome. Are there like besides your friend inviting you to the like the nutrition classes, are there any like key milestones or moments that solidified your passion for the field?
Yeah, that's a great question. So I think growing up, I played sports. My dad was and is an endurance athlete, so I grew up. We paced him for 100 milers and Ironman events and some of those things. So my parents were pretty focused on nutrition. Um, So I was kind of interested in it from that standpoint. I think what really got me into it in college was that I had instructors that opened my eyes to the fact that nutrition was so complex. It was so much more than I thought it was. And there's so much science involved, and I always really liked biology. I liked those kind of classes in high school, but I didn't really know what to do with that.
Mhm.
Um, and so I think just being, interested in that, and I was interested in working in healthcare, and that seemed like a good sort of direction for me to take because I knew I didn't want to be a nurse. I knew I didn't want to go to medical school. There were some things that I knew I didn't want to do. And so when I found the dietetics program, it was, it kind of seemed like everything I did want to do.
Mhm. And then the last question for Morgan for this section is just once you graduated with that degree, what was the pathway like from just like having just finished college to becoming the supervisor of inpatient clinical nutrition? Like what was like the stepping stones kind of?
Yeah, it's been a journey. I'll go fast. So after I graduated from high school or from college, I did the Montana dietetic internship and I did my clinicals and billings, and then I traveled around. I had worked in the kitchen at the hospital when I was a college student. So when I was done with my internship, I came back and Janae let me come back and work in the kitchen. I studied and got my RD. Um, I've been working here since 2013, and the first few years there weren't any open positions for dietitians. So I worked in the kitchen, washed dishes, baked cinnamon rolls, did all that stuff. Um, and then jobs kind of started to become available. So in that 10 years, 11 years here, I have worked as a dietitian in the food service over the patient menu. I've worked as an inpatient dietitian. I've worked as an outpatient dietitian. I worked as a cancer center dietitian. We used to have a contract with CHP, Community Health Partners, where an RD would go there 1 day a week. I did that. And then I've also been involved in leadership in this department over the clinical dietitians, but also over, at one point, kind of during COVID, I had 7 outpatient clinics. So some were not even related to nutrition. I had neurology and rheumatology, neuropsych, just things. There's a lot of moving pieces in a hospital, and that's just kind of how things went. But after being a people manager for a while, I decided I really just wanted to come back and be a dietitian. So I think I did that for about a year or so, and then there was a supervisor position available, and I I wanted that position. So
Awesome.
that's how I got here.
That's awesome. I'm gonna move to Janae, and I'm gonna ask you for the first question, the same question that I asked Morgan. I know you had a certification, and I just want to hear a little bit about how you got into that, if you planned on going to that after you graduated high school, and what that looked like for you.
So I did not plan on going straight out of high school and staying in food service. I did work at a long-term nursing home in a small town that I lived in, and that's kind of where I started out in the kitchen. And then I moved to Bozeman, and the most convenient jobs for me to get at that time was in food service. So I kind of learned to like it. And so I like to start, I started out like as a dishwasher, and then I got to learn more about diets and preparing the patient meals. Then I learned, how to cook them, how to apply all of that therapeutic diet information to the patient. So it started intriguing me more and more. So I ended up going through the University of North Dakota and got my certified dietary managers because I found that I am kind of a control freak. So I like to manage people. So that's what I wanted to do. So that was kind of my stepping stone to get there. So that course covers the certified dietary manager and the certified food protection professional. And basically, in a nutshell, it is the ability to make sure that everything that we are preparing out of this kitchen, and all the staff are aware that everything is safely done. We're making sure that we're not contaminating with any allergens. We're not giving any patients any thing that they may be allergic to. We're following the diet that the diet order has been put in either by the RDs or the physicians, that they don't have too much sodium or too much fat. As Morgan said, there's a lot of moving parts. So that's where I got in that certification. Then I continued through, I started managing about 15 years ago. Um, and a lot of things change, and so I ended up getting a bachelor's. I went back to school and got my bachelor's in healthcare management. So that kind of has helped me on the financial end of learning how to run a department, making sure that we're staying within budget, but being able to provide and meet the needs that the patients have, that kind of stuff.
Mhm. And then the second question, oh, you kind of did go into that already a little bit about what the certification entails. Can you tell me about any memorable experiences from your career so far that have solidified your passion for like managing the dietetic side and the nutrition side of like healthcare?
Yes. One of the things that I enjoy the most is I work with a lot of dietetic students, and it's fun to watch them learn and grow in the department, and they also get some leadership skills, and then for them to come to me and ask for letters of recommendation so that they can get into their internships of choice and things like that. And then when they come back to me and say, hey, I got that I got my RD, and I appreciate all the experience I got from you, that's very, very rewarding.
And I know something that Montana HOSA has been like trying to highlight, and just HOSA in general has been trying to highlight for the past couple of years, is certifications rather than like just looking at healthcare as like doctor, nurse type stuff. So, would you recommend your certification, or are there any other like certifications in nutrition that you would recommend or healthcare in general?
I would definitely recommend my certifications. The nice thing about the certification is it's not super costly. It runs about $600. It is an online course. You do have to have a registered dietitian as your proctor, but Morgan has proctored some of the staff. It's a great tool for people that want to continue learning and growing within the department or within nutrition. It's a great stepping stone for them.
Mhm. Okay, I'm gonna move into careers a little bit. And again, and to look at Morgan for this one. Can you describe your role in supervising inpatient clinical nutrition services and like how you collaborate with like the teams in different areas and ensure patients' nutritional needs are met just by like helping, I guess, everybody collaborate and like communicate well, if that makes any sense. Or I could rephrase
Yeah,
it.
yeah, no, it does. Um, so I'm a working supervisor. So there are two of us, RDs, that cover all of the adults that are admitted to Bozeman Health. Then we also have a NICU and a pediatric dietitian, and she takes those folks. Um, while I do have supervisory responsibilities, things like payroll, working on quality and performance improvement, thinking about what types of things we can do better and where we have opportunities. I'm also just seeing and taking care of patients a lot. That's a big kind of part of my job too. So um, I guess what that looks like for an inpatient dietitian is we are working in an interdisciplinary care team, kind of like you said. So every day we go to rounds in the morning. We work with um, doctors, nurses, pharmacists, respiratory therapy. Um, there's so many other people I'm going to forget, but and then we also work with ancillary services like radiology, the surgery service, some of those other kind of specialties. So I feel like dietitians are really important. We're the subject matter experts on kind of all things nutrition. So um, if we need to advocate for something that a patient needs, if we feel like they need more education, or if there's some way that we can support them on discharge, we will bring that up. If there's anything that we think that the medical team should be doing, like adjusting medications or anything like that, we'll bring that up too. So we really are just kind of a voice for our perspective on optimizing nutrition in the acute care setting, um, and also the voice for best practice. Even with doctors, nurses, seasoned healthcare professionals, I still find we do a bit of myth busting because there's a lot of misinformation about nutrition coming at people, kind of no matter what your career is. So we do a bit of that too. But I would say the three biggest things that we do are tube feeding, NIV nutrition, malnutrition identification and treatment, and then nutrition counseling for and medication counseling for type 2 diabetes. And then we do everything else in between, but those are kind of the big ones.
This isn't a question that I already like had written down, but like, can you elaborate on some of those like common misnomers in nutrition a little bit? Like, what are some ones that even like the doctors and nurses often get wrong? I'd love to hear a little bit about that.
Yeah. Oh, there's so many. It's interesting because it kind of cycles with um, sometimes what the fad diets are because that's what people are talking about on social media or on TV. Um, I am constantly having conversations with nurses and providers about how patients can and should eat carbohydrates, especially when they're acutely ill. And I feel like that's kind of in alignment with some of the social media stuff where there are trends right now that are really protein focused and anti-carbohydrate. And so um, that's where we again can bring that evidence-based practice to the table and say, look, here's a study with 1 million people in it that suggests that we do X, Y, and Z, provide this many carbs. Um, so that's a good example of something that we've talked about. Um, we also have physicians that use labs sometimes that have essentially been made obsolete at this point, or we know evidence shows that they're unrelated to what the physician might think they're measuring. So um, we we're kind of there for quality control in that sense too, of just making sure that everybody's on the same page with the most recent guidelines and recommendations.
Hmm. I'm gonna move to Janae with this question, and it kind of goes along with the quality control idea. Can you share some insights on how you get manage hospital nutrition services, like how you guys ensure food safety within that, and like make sure people aren't getting like sick from the food or they aren't getting contaminated with like allergens and stuff like you were talking about earlier?
Yep. We do a lot of training. We serve safe train the majority of our staff so that they all understand the importance and the why behind food safety. We go through a lot of case scenarios as far as if you don't do it this way, this is what could happen. Um, a lot of it really is really focusing on making sure that the staff are just following all the regulations as far as labeling food properly, dating, timing, all of that kind of stuff. There's lots of regulations with food to keep it safe, and it's continually monitoring that every staff member is continually doing that work. So every meal we serve, we have to take temperatures of it. We time what time we do. We check it again. We can't hold it longer than 4 hours. If we do, we have to cool it down promptly. There's lots of procedures in place that just keep everything safe, even to the level of washing dishes. We have to make sure our dishwasher temperature is at the right temperature to kill any bacteria, um, those kind of things. So we are checking that stuff constantly throughout the day. We're documenting that. Um, and, really it is just focusing on the training piece and then the monitoring of.
Okay. And then I have two more questions for you. I'm going to direct the last question. I wasn't sure who I was going to direct it at, but I think that you'd be good at answering it. My second to last question for this section is how does your role specifically support the staff of Bozeman Health to like just how does it specifically support them? Because I know you went into yeah, I know you went into it a little bit, but just hearing a little more.
My role really, it supports the entire organization in a lot of fashions. So we work very closely with nursing, taking care of the patients. We have a strong focus on, preparing the patient diets correctly, but we also serve between 1,200 and 1,500 meals per day in the cafeteria for the direct staff that are working here. So we have an impact on pretty much everybody. And, with that being said, all that food has to be just as safe and as good a quality in the cafeteria as it is for our patients. So
That is actually incredible. Um, wow. And then that last question that I think you'd be really good at answering is what are some important careers in the field, in like the field of nutrition and dietetics, or like the department that you see get overlooked a lot, or careers that you feel are very influential that people might not be seeing that you wish got more sight, if that makes sense.
Yeah, Morgan, you might have to help me out on this as well.
I
I think
can.
one thing there is definitely a lack in understanding that food service is just as important as dietetics and in every fashion because it all starts somewhere. So that's one of the things I think is super important. There's lots of opportunities in food service to learn and grow. There's chef positions, there are supervisory positions, management positions, and I think everybody kind of tends to lean towards the restaurants, when they're looking at chef, culinary degrees, hospitality degrees, where hospitals actually are pretty big in that area as well.
Okay. And now we're going to move into the cancer section. So I know this one's a little bit more tailored toward Morgan, you said, but I would love to hear some insight from you too, Janae. And so, for either of you, how does nutrition impact treatment and effectiveness of recovery within cancer, like with cancer patients across the board, not just like specific kinds of cancer?
Mhm. So, nutrition during cancer, it's hard to be so general because everybody's so different. One thing that dietitians are really good at, and what we're here for, is to meet the patient where they're at and learn enough about them so that we can provide really specific recommendations so that they can make changes that are doable and sustainable for them if they need to. Or on the flip side, we can say everything that you're doing is perfect. You don't need to do anything differently. So it may just be reassurance that somebody's doing the right thing. Typically, what we'll do is just like with any patient, we'll take a diet history, a diet recall. We talk about allergies, any kind of restrictions or things like that. So we look at food patterns and meal timing, and then we will write what's called a nutrition prescription, where we use a bunch of different evidence to guide prescribing somebody a range of calories, protein, fluid. We can do that for macro or micronutrients too. Um, and then we'll kind of compare what they're already doing. And then what we do is just try to bridge the gap. So if there's a deficit in sort of the best case scenario and what they're doing, we'll talk to them about making behavior changes that can help get them kind of closer to the ideal scenario. Um, Often in cancer treatment, weight loss is one of the biggest concerns, meaning unintentional weight loss. So, one of the goals that we often have for patients during cancer treatment, regardless of their body weight or BMI, is to maintain their weight through treatment. Um, we also, if people are able, we'll talk about exercise because typically people with higher lean body mass, so more muscle, fare better with chemo and radiation. Um, if a patient where we kind of get a little more, even more involved would be, for example, for patients with head and neck cancer or some kinds of GI cancer who can no longer take food by mouth or they have a non-functioning GI tract. Um, One of my board certifications is a certified nutrition support clinician, um, which means that I know a lot about tube feeding and TPN. And so if somebody has cancer and we need to come up with an alternative way to feed them, what will we use? Where's the tube going to go? How's that going to work? And then we have to coordinate all of that with outside agencies to make sure that the person can then go home and kind of carry that out. Some of what we do in cancer too is specific. So if a patient's had taste changes because of chemo, we might talk about using certain products to change the pH of their mouth before they eat. If everything tastes like metal, we'll tell them to switch to plastic silverware. We have all these little tricks for these real specific kind of symptoms that can impact weight and nutrition during cancer treatment that patients might not think of. But after being in that kind of realm for so long, I learn a lot of tricks from other patients and also just from other people that are in the industry. So we can help on a big scale, and then we can help with really nitty-gritty stuff too that people are struggling with.
Mhm. For Janae, we were talking about tube feeding and that kind of stuff. So how is food like that prepared? And like how do you, especially with like immunocompromised patients like cancer patients are, their immune systems are like really not great in that moment. How do you guys focus, especially in like those situations, on making sure that a patient doesn't get like a nosocomial infection or anything like that through their food or anything like that?
So when we have a compromised patient, they typically will put them on a neutropenic precaution or low microbial. So that indicates then to us that we are not going to give them any fresh fruits or vegetables unless they are thoroughly washed. A lot of times we just eliminate them altogether, depending on what the choice is, either by the patient or the physician. Making sure that everything that we provide is handled properly. We're making sure that we're washing our hands, we're using glove use, we are cooking everything to the proper temperatures, we're holding everything at the proper temperatures to make sure that everything that they're getting is safe. On the tube feeding end, those are products that we order in, and so whatever the dietitian orders is what we send up, and then nursing then administers that.
Okay, I see. Um, we talked about, you covered a lot of the stuff, Morgan, that I was gonna ask.
That's okay. We can still talk about it.
Um, so I know especially with radiation therapy, and throat cancers, it makes it like the throat more brittle or kind of constricts it, and it makes it harder for
Mhm.
them to swallow. If they wanted to still consume solid food, what would that look like for either of you?
Yeah, that's a good question. So kind of circling back to one of your questions for Janae, the first question that you asked was about tube feeding. We don't do any what are called home blenderized tube feeds in the hospital. Everything comes to us sterilely in little cartons, essentially. And so there are all sorts of different kinds of formula. So what we receive and then what the kitchen's sending up to patients and what we're prescribing is a sterile formula in a little can. Um, Patients can do home blenderized tube feeds if they want, but we don't typically start them on those in the hospital just because like Janae said, there with food safety, there's a lot of things to kind of keep an eye on, and it would be difficult for us to do that well from like an infection prevention standpoint. Um, with what was the question that you just asked? Sorry.
The one that I just asked is like
Yeah.
specific is how can they like how could a patient if they wanted to still consume solid food or like food?
Oh, totally. Okay, so yes, radiation can make a kind of a sunburn on the inside, is how people will describe it. People can also have other side effects like mucositis, where they get really ropey spit, and things will happen like that where they're having issues swallowing. Um, Patients with tongue cancer, if you've had part of your tongue resected, it's really hard to swallow. So what we would do for those patients who are maybe having difficulty swallowing, but they could still eat and they want to, is that patient would be assessed by a speech therapist, and that speech therapist will trial different textures, liquid kind of thickness and consistency with them. If they need to, they can do a video swallow, which is where the patient swallows a barium solution. They can see in imaging what's happening with their swallow. So the speech therapist is actually the one that's going to determine which foods are safe for the patients to eat. in that situation, and they'll typically order a therapeutic diet. So the way that it would come to us is there's a patient, say they've seen speech therapy, who ordered a pureed diet and honey thick liquids.
Mhm.
So we know what the diet needs to be. So then we can do education with the patient on what kinds of food can you have, where can you get those types of foods, how can you modify foods that you already like to look more like that. So we can talk more specifically then about how to meet their energy and protein goals with now maybe this new restriction.
Mhm.
Um, just like with anything, PT, patients can choose not to follow our recommendations, and that there are times that can happen, um, and that's okay. Everybody, kind of gets to decide what they want to do in their own healthcare journey, but um, that's that's how we would look at that if they weren't able to take enough by mouth. So this happens a lot too. Say that's something that they want to do, but they can only need about 25% of their needs. Then we would talk more about artificial nutrition interventions like a feeding tube or something to kind of supplement what they're eating by mouth so that we can meet the goal of weight maintenance through therapy.
Okay. I have a question for Janae because we talked about the antimicrobial, like marked for antimicrobial earlier. It brought up, this is not necessarily related to cancer, but it brought up a question for me. Given the breadth of different like nutritional needs and conditions of patients throughout the hospital, how are like what are some examples of ways that food preparation shifts and precautions are taken differently in different situations, if that makes sense? It's a pretty broad question, but if that makes any sense.
It does. So, for example, we have color coded our tray tickets and our trays to a degree. So, if we have a patient that is on aspiration precautions, whether they're having swallowing issues or they need certain consistencies of food, we have that flags on our tray tickets in a green print, and then we put a green placemat on their tray so that that kind of notifies everybody as we're preparing that. That we need to be super careful and make sure that we're getting the right consistency for that patient.
Mhm.
We do the same thing for food allergies, only the color code is red. Um, and then as far as the cooks go with the equipment, we actually have brought in speech therapy to do some in-services with them to make sure that when it says minced and moist, they know exactly what minced and moist is. And so we track that a lot. There is a fork test that we do to make sure that everything that we're providing for those patients is soft enough and appropriate for their needs. As far as thickened liquids go, we order in our thickened liquids pre-thickened. We do have some packets that we do send up to nursing if they want like thickened water at
Mhm.
bedside. We don't thicken anything on our own in the kitchen. We allow nursing do that at bedside. But otherwise, if they need nectar thick, we have pre-nectar thick juices and things like that.
Okay. I have grossly overestimated the amount of questions that I had for this interview. But I'm also sure that there are a lot of things within your guys' field and your careers and careers you guys work with that I've looked over. So like what are some things that you guys think that should be brought up in this that I haven't yet, you know? Like
I think all your questions have been really good. Um, One of the things that I didn't really consider, um, and maybe a smarter person would, but when I was in college, I was really just choosing my majors based on what was the most interesting thing to me.
Mhm.
Um, I wish I would have looked a little bit more into how much does it cost to live in Bozeman? How much am I going to make? And kind of realistically think of those things. I don't think that would have changed the outcome, but I think if folks are considering all different kinds of healthcare jobs and they're thinking about how much time and effort they want to put into something, um, they should look on the Labor Bureau of Statistics and they should kind of see what is the average salary for that position. Um, I think dietitians do okay. We make kind of similar money to nurses. Um, but when you live in a place like this, sometimes that's still a little tricky. And so sometimes it feels like, oh, I'm looking so far ahead because I haven't even, you know, graduated or anything. But if I had it to do over again, I think I would have looked at that a little bit more.
And how would you guys mitigate, like, if you guys were to look into that and say a person wanted to work in nutrition and food services, but they felt like they needed to make more money.
Mhm.
How do they think, how would you mitigate that? Like, how would you make that balance work? Because obviously you're not going to get a ton of money and the job. That's not how, but like, how would you guys go about like balancing that out?
Yeah, I think one of the important things is to look at kind of geographically, where are you going to need to live? I kind of growing up here and graduated from Montana and I thought, or from MSU, and I thought, oh, well, there will be lots of jobs for dietitians here because everybody's so healthy. But the opposite is true. Um, if I wanted to move to Dallas or New Orleans as a new grad, I could have made a lot more money and gotten, kind of that clinical dream job right away. Um, but I didn't want to live in some of those places. So I think just thinking too about if you're going to pursue this particular career, are you willing to move? Where are you willing to go? Um, I only have a bachelor's, but now to be a dietitian, you have to have a master's. Um, and so thinking too about, do you also want to get a master's or spend time studying healthcare administration? Because typically you can make more in leadership positions. So are there extra board certifications that you can get that might bump your pay? So there are things like that where geography and experience and credentials can help you make more money.
Mhm. I had a question earlier, but I totally forgot what it was. Oh, um, Morgan, sorry. I've asked Morgan so many questions. I wish I had more for you.
It's okay.
Um, Morgan, you talked earlier about how you have some administrative responsibility, but you also work in the clinical side as well.
Mhm.
Like that to me sounds like a very fortunate position to be in, where you get that balance of like administrative work and you get to work with patients. What is the like, is that a pretty standard thing or is it not?
It's hard to say. I would say it's not a super standard thing, although Janae, your supervisors are working supervisors too. Um, the reason that I think that's really important is because I've had manager jobs before where I was not working in the clinic or practicing what those clinicians were doing. Um, of course, I always still wanted to collaborate with people, but when it came time to actually figure out how to make improvements and changes in the department or to identify what's not going well, it's really hard to do that as somebody who is not doing the work. So I think it is a fortunate position in that I really like the balance that it affords me. I can use my brain for different things. But I also think it's really valuable because I'm also at the bedside, and so I see what the doctors are talking about. I know what the patients are having issues with, and so when the hospital comes to us and says, "Can you make a performance improvement plan?" My answer is always, "Absolutely, I can. I have a list of things that I think we could do better." Um, and so I think it's a good thing from kind of numerous perspectives. I feel fortunate to have the job that I do.
Mhm. This one's for both of you respectively. I'm gonna have you both answer it. Looking beyond just the healthcare side of it, like a question that faces a lot of students today going into college and going out of college is what is like work-life balance like in these careers? Am I going to be able to have time with my family or my friends, or am I going to be able to spend time doing the things that I want? And so my question is, what does the work-life balance look like in your guys' respective careers? And I will start with Janae on this one.
So most management positions are salaried positions, which means you might have to work 80 hours in 1 week versus 40 hours in 1 week. But to be honest with you, I feel like if you manage your day and you manage your tasks, you have plenty of work home. I just got screwed up there. Work home balance. Um, it's really about being able to learn to let go and remember that that work will still be here tomorrow.
Mhm.
Um, so overall, I mean, there have been times in my career here that I've had to work a lot of extra hours, whether it was because of staffing or during COVID or things like that. But when you look at the big scheme of things through the course of many, many years, I have plenty of time with my family, and I spend plenty of time here too, but it does balance out. And it's definitely rewarding in that fashion, I feel.
And now I'm gonna have Morgan answer that one. Same question.
I feel like, um, and I can speak for the other inpatient dietitians too, we have a pretty great work-life balance. Being an inpatient dietitian, there is a little bit more of that we kind of ask of those folks because we need somebody to be on call on holidays and weekends. But I also just hire part-time staff to take call. So if we have people that are working full-time that do not want to take call, they have that option. Um, well, the other thing that I like about any kind of inpatient job, well, this one, is that I don't have a full patient schedule. I don't have to see somebody at 11 and 11:30 and 12. I can kind of manage my own work, and prioritize how I want to. Um, so if I have a doctor's appointment on Zoom that I need to do in the afternoon, I can move things around to make things like that work, which I think is really helpful to have some flexibility. Um, one of the things I also really like about my job is I'm not super extroverted or introverted. And I feel like my job gives me just the right amount of balance of working with people and teams and socializing, and then going back to do work independently, either by myself or just with me and a patient. Um, and so for me, in terms of how I interact and spend time with people in the workplace, which will get more important to you as the longer you stay in a position, I found that balance here too. So good work-life balance and then a good balance for me in terms of the type of work at work.
Hmm. All right, so this is gonna be like the last little section of questions that I have before the very end. It came up when Janae was talking about like fluctuations in like the amount of work necessary. You talked about COVID, and I kind of like I'm curious about how your guys' jobs changed during the pandemic and like what specifically changed and what a person would anticipate if something like that did happen again. Because that is another, I think, concern people have is like, oh, if there's another pandemic, am I going to want to be here?
I can start with that. It changed dramatically for the food service department, being part of the hospital. We had to shut down a lot of services that we provide. So, for example, in our cafeteria, we have a lot of self-serve, a salad bar, those kind of things. We had to start packaging everything. So they were just grab and go. We couldn't have things like that out. Um, we learned to do a lot more sanitizing than we used to. We also found things like we probably should have never been doing this in the first place. For example, letting people refill their cups with ice, so we stopped a lot of that kind of stuff. We started using different chemicals for things like disinfecting our patient tray carts
Mhm.
and those kind of things. We changed a lot of processes there.
Mhm. And you, Morgan?
Ours was more just kind of related to a lot of what was nursing, what nursing was going through related to PPE. So, we had to get fitted for N95s and we had to figure out how to kind of um, still provide care in the midst of all these new precautions that we hadn't before. And then thinking about things, we teach a lot of stuff by demonstration. So if we're going to take a glucometer into a patient's room to show them how to check their blood sugar and they have COVID, what do we do with it? We can't leave it in there. Like, so there's all these little things that came up in practice that same, a lot of it was just kind of infection prevention and control that we hadn't had to think about, I think, in as much detail before. Um, our the practice of being a dietitian didn't necessarily change. One thing that did change kind of the landscape of healthcare during COVID was that with all these people in respiratory failure, there were all these people on ventilators. And folks on ventilators need to be fed with a tube. So we saw huge formula shortages, um, ventilator shortages. So that had rippled out to then kind of Janae's realm in the food service and our ability to get the products that we would use to feed people. Um, Once that initial kind of phase of COVID started to improve, where we didn't have an ICU full of ventilated patients, that got better, but the industry never caught up. So we still have formula shortages often.
Hmm. Okay, I'm gonna move into my last section, which is like the conclusion. It's like how people can get into the careers and stuff. And so I'm going to focus on two people, like two groups of people specifically, because the first group is like high school students who just graduated, how they can get into food service and stuff. And the second group is this question came up literally yesterday in my head because I was talking to one of my teachers and she was talking about she was retiring soon and she was thinking about going into nutrition and food services or maybe dietetics when she finished teaching. And so I wanted to look at like at those different phases in life, how can somebody look at getting into food service nutrition? What does that look like? So let's start with just having graduated high school going into college, and I think that I'm gonna have Janae answer this one. How can somebody who just finished high school, what can they look for? What kind of jobs can they look for? And how can they look at going into food service?
The best jobs for those just graduating high school are our patient services jobs,
Mhm.
which is, learning the dishwashing positions and then getting the trays ready for the patients. They learn a lot about the diets while they do that. And then you can start building from there. Because once you get those positions down, then it's time to start cross training you to the next level of maybe preparing the tray tickets and then even going into like prepping some of the food. So there's kind of stepping stones there that help build their knowledge of overall operations of a food service. And then also it also shows them how we interact with the dietitians and how what we do makes a difference on the floor with those patients that are receiving our trays.
Mhm. And so going into those like careers like the dishwasher and stuff, there's a lot of upward movement that's possible from there throughout the entire like kitchen and like dining services and food services across the hospital.
Yep. And we do on the job training all the time.
Okay. For Morgan, what kind of jobs, and I think this is for kind of this kind of applies to both of you because I think that going into those food service jobs that Janae was just talking about prepares you for dietetics a little bit, or like maybe going into college for dietetics. But are there any other jobs, or would you just reinforce that idea as far as like preparing yourself for dietetics and giving yourself that like career jump start?
I think the service is probably a really good place to start. I know that some interns with MDI are PCTs, so patient care techs.
Mhm.
While that doesn't um, really give them any insight into how the food service works, it does show them how the electronic health record works, and how some other kind of parts of healthcare work. So I think it's still helpful. I think those are probably the two most realistic kind of entry level positions.
Mhm. And then like looking at people who are already post undergrad, looking to like they've gotten their degree, they've had a job for a while. They're who knows however far into their life. What does like the transition maybe kind of look like from
Mhm.
a different, completely different career into dietetics or food services? This is a question I'd like you guys both to answer.
I can go first, I guess. So if somebody, for example, was a teacher and then they wanted to become or they wanted to work in nutrition and dietetics, there's a few different routes you can take. Um, you have to have a degree in something related to food science.
Mhm,
So likely if you had an unrelated bachelor's, you'd have to go back and get a new bachelor's in food science.
mhm,
Then you'd have to do your internship um, and your master's now. Um, we registered dietitians are registered by the national board that ensures that we have all the training that we need to kind of practice professionally. Um, anyone can call themselves a nutritionist. So you could read a Men's Health magazine and say, I'm a nutritionist now because I read this. So this is the distinction in where some people will pivot into like a wellness career and maybe take a short certification course or something like that, and then they'll kind of be practicing in the field of nutrition. Um, if anybody wanted to really, make that a career, my recommendation would be to get your RD just because you have so many more options.
mhm.
Um, does that answer your question?
Yeah, that does.
Okay.
Absolutely. And then just like in the food services area as well.
Yeah, as it relates to food service, it's more would be more a common situation where the type of positions those individuals would probably be looking for would be like our team lead positions, our supervisor positions, because they usually have, some kind of knowledge and leadership or organization, those kind of things that would be good qualities for those type of positions. Doesn't mean that they wouldn't start with the lower positions as far as how they would be trained, because you have to learn every position in order to lead.
Hmm.
Um, so we would usually start kind of from ground zero and then build up with that.
Hmm.
One of the things that's pretty popular as well is our spoken menu position, which is the position that they go up and talk directly with the patients and do their meal selections.
Hmm.
So that's pretty intriguing for especially somebody that maybe wants a career change a little later. I have one individual right now that's doing that and has really enjoyed it.
Hmm. All right. We're pushing close on the time, so I'm just gonna ask Morgan, would you touch a little bit, since Montana State is the only university in Montana that offers a dietetics degree, would you
Mhm.
touch a little bit on that MDI program, like what it is, what it entails?
Yes. So I think this last year MDI took 16 interns, maybe. So it's not an enormous internship. Um, getting into dietetics internships is fairly competitive, so you want to make sure that you're keeping your GPA on the high side. For folks who went into college knowing they were going to be dietitians, they were involved in like the Montana Student Academy of Nutrition and Dietetics. So there's these other kind of groups that you can be involved in. When it comes time to apply for the internship, if you get selected for the one that you want or for MDI, um, you'll have different rotations in those different kind of categories that I had talked about at the beginning. So community nutrition, public policy, maybe sports nutrition, maybe not, food service, and clinical. So during your internship, you'll work with registered dietitians that will kind of show you all of those different options. Um, now that there's a master's attached to MDI or that option, you can get financial aid. Um, during your internship because it is an unpaid internship.
Hmm.
Um, so that's helpful when I had done it because there was no master's, you just had to call your aunts and uncles and see if they could help you out paying for it. But now, so that's it's a CDR approved internship, and that's the organization that certifies us as RDs. It's typically 9 months to a year long, although there are some people who do what are called distance internships where it's a lot more independent, and those ones can last up to 2 years, depending on how those people kind of stagger their rotations. But typically, if you do a structured rotation through a university, it's going to be 9 to 12 months. After that, they usually recommend 2 to 3 months of studying, and then you can sit for your registered dietitian exam.
All right, that's all I really had for you guys. If got 5 minutes left, if you guys wanted to touch on anything, but that's all I had question wise. Thank you guys so much for like meeting with me and taking the time out of your guys' day to answer all these questions and really help out. It means a lot. Um, so again, thank you
Yeah,
guys so much.
You're welcome. I think you had really good questions.
Thank you.
yeah, that was great. I hope it's helpful.
It will be. I hope it I hope it helps bring more people into those like nutrition careers because I mean before I knew what nutrition and dietetics were somewhat, but like before my research for this and then just talking to you guys right now, I kind of never really realized how integral you guys all are in the health of the patients because everybody thinks like doctors and nurses and they see these like careers on TV and stuff and they're like, oh, that's super cool and that's the whole thing, but it really isn't. And there's so much stuff going on behind the scenes that people never really realize and they take for granted. So it's really awesome being able to highlight that for people.
Yeah, I'll say just because I love my job so much that if people are interested in healthcare and clinical healthcare, especially, there I've loved it. You still get patient interaction. You're still a part of the team. You're still practicing. Um, you still get to do a lot of um, kind of science and interventions, and there's a lot of helping people. But if you're not somebody who is cut out to be a nurse, if you don't want to deal with toileting and hygiene issues, and some of those other things, which love our nurses, but sometimes they do the dirty work that I don't want to do. Um, Being a clinical dietitian can really kind of get you in there as part of the team, maybe with a little less hands-on with some of the grosser stuff.
Hmm.
To, to like just be real.
Hmm. All right. Well, thank you guys so much. That's all I have.